What's up, Dr. Gaelic? It's me, Malin Rasmussen, showing you my voice and motor speech disorder binder. So, for the voice portion of our class, I have all my homeworks in here. Probably less important. All of my homeworks. And then in here I have all of my notes for the voice section of class. All wonderfully color-coded. Yeah, this was essentially my study guide for the final. Voice resources. Here I have a list of pharmaceutical medications that could have an effect on voice. I couldn't find this on your web campus, but I got it from Northwestern University's website. Components of my non-instrumental. So here is my awesome cranial nerve assessment info. I highlighted what I actually have to do. And then, of course, everything around it is kind of an explanation of if there's damage, what could be going on. Tongue strength there, laryngeal performance, observations, breath support, observed posture. We have our VHI score here, very important. And then findings, recs, and referrals. Here I have my voice parameter reference data. Also very important with my wonderful piano, talking about keys and octaves and where someone could fall. Has a lot of norm information in here, which is great. Rainbow passage and grandfather passage, also important. Some vocal warm-up exercises here. Anti-reflux protocol, vocal warning signs. At this point, I know all of those. Vocal hygiene, which of course the most important is hydration. Just kidding, just kidding. Voice care for singers. How to keep their voice healthy for the next performance, if I ever get the privilege of working with singers. Care for the singing voice. Nasal saline irrigation to kind of help breathe and decrease post-nasal drip. About it. Chronic cough control. A little more information on that. Chronic cough techniques. Voice forms. Oh, we have that parameter reference data in here. Sorry about that. We have the Kate V. And kind of the origin, instructions, and how to receive your data in here with the Kate V. So that's the whole Kate V form. Scoring, cautions, that kind of thing. And here we would have a voice intake form. So this would be part of their case history. Have your patient fill this out before you come see them to help you kind of form your hypothesis. Here's another voice evaluation form. Templates. So then this would be what the clinician's filling out for their observations. Recommendations. Then we have the voice handicap index, super important. And then this, how to score it. And then kind of a different format of the VHI, it's just one page. And then motor speech disorders. So homework to go here. I haven't finished the motor speech disorder homework yet. I guess neural substrate should be in there, so I apologize, but that will be in there soon. Notes I've taken so far on this portion of our class. So, sorry if you can see that, it's a plastic sheet here. But dysarthria types, the localization, general neuromotor, specific neurologic characteristics, and then the causes of vitamin D. Love that. And here in these plastic sheets, I also have information on all the cranial nerves, sensory and motor functions, what could be going on if one of them is being affected. And we talked about this picture today in class, actually. So these are the branches of the vagus nerve. Important because, of course, if something happens up top here on the pharyngeal nerve, everything below could be affected, and then if something lower, like the recurrent or branches of the superior laryngeal nerve are affected, it could be less severe, maybe. And then here's another kind of image of that. My notes for motor speech so far, kind of prep me for the quizzes. Color-coded as well. And then some motor speech disorder resources here. So here are the components of a motor speech exam. Some of my notes. And then this, I got, because I was on Dr. Brandkamp's evaluation team this semester, so we did a couple of informal dysarthria evaluations. And formal, I guess we used the French A too. So, yes, this just shows what to look at and what to ask about in relation to respiration, phonation, resonance, artic, of course, prosody, questions to ask myself, questions to ask the patient. It's a great handout. Questions to elicit conversational speech. Assessing reading, or assessing articulation through reading, so it kind of gives the place of consonants to see what they have trouble with. And here's sentences. And then this is also kind of an informal, so now we're in, forms, official forms. Also an informal motor speech eval that a clinician would be filling out. So looking, of course, at their facial structures at rest, during movement, during sustained postures. Tongue gets into the cranial nerves here. And then clinical examination. So this would be an intake form for them. So this would be something that the client would fill out to give us some case history to get a hypothesis going. And then the end of it is, again, some informal assessment techniques.